Hello, I am urologist Omer Erdamakaya. Today I will give you a short video presentation on penis fracture, penis curvature, and how masturbation can damage the penis. The fracture of the penis usually occurs during sexual intercourse. We can say that this is an unfortunate situation characterized by the bruising and swelling of the penis as the sheaths of the spongy bodies filled with blood during erection are torn and the blood fills under the skin from there. Can patients be permanently damaged after a penile fracture? Could there be permanent curvature? Unfortunately, if patients are not treated early, the possibility of permanent damage increases. If there are vascular or nerve injuries during the injury, erection loss and erectile dysfunction may occur. Apart from that, in rare cases, there are those who can break the penis, usually in the position where the woman is on top and the man is below or during extremely traumatic masturbation. Also, I have seen penis fractures several times in some patients who tried to apply the penis lengthening exercises they saw on the internet on themselves. After the penis is broken, scar tissue occurs in the penis and it can distort the shape of the penis and make it curvature. How does the curvature of the penis happen? Penile curvature occurs in two ways. The first is congenital, that is, the curve of the patient's penis is congenital. In these patients, what we pay the most attention to is whether the patient can have sexual intercourse. If the patient cannot have sexual intercourse due to congenital curvature, the patient can be operated on. The patient to be operated on must take the risk of loss of sensation in the penis or pain during erection for 6 months after the operation. And due to curvature, we put permanent stitches on the penis. The patient can feel these under the skin. He has to take the risk. It is not certain in every case, but the patient should understand them well before the operation and the doctor should explain them well. Apart from that, there is Peyronie's disease. Peyronie's disease is a disease that is not congenital and is characterized by the change of tissues in the penis, which we call scar tissue. We can briefly describe these tissues as follows. In the penis, tissues such as rough scars that develop after the healing of burn wounds occur. This is a situation that the body creates on its own. It distorts the shape of the penis and may cause curvature. Peyronie's disease may cause erectile dysfunction. Usually, it takes around 1.5 years. If the patient comes early, drug therapy can usually successfully stop the disease by 90%. In some patients, the disease process progresses, and permanent deformities may occur, forming a horseshoe or a cane head. Of course, since these patients cannot have sexual intercourse, they need to be operated on. Other than that, does masturbation harm the penis? If masturbation is done very quickly with a direct focus on the orgasm, premature ejaculation behavior may develop. Or if masturbation is done in a very pressurized, traumatic, and dry way, when the patient starts having a sex life, he might take his partner to the doctor because he can't feel the vagina or because the vagina is too wide. Or when it is done excessively traumatic, it can damage the penis and cause permanent damage. Patients come from time to time due to this. Apart from that, there is no harm in performing masturbation normally in single men under normal conditions. Certain situations need to be paid attention to. Thank you for listening. Best regards.